Let's get started. My name is Dr. Matala Nubufaya, and I am the coordinator of this semester's seminar, where we're focusing on artificial intelligence and big data in healthcare. And this is a course under the Department of Pharmacy and Clinical Administrative Sciences at the University of Oklahoma. And today's presentation is going to be on data overdose, side effects, and metabolism of big data in 21st century. So let's talk a little bit about our speaker whom I met last year at ISOCO, and I realized that, oh no, he had to be in class. I had to bring him to class because he's so loaded. Okay, so his name is Igor Matias, and he's a PhD student and member of the Quality of Life Lab at the Institute of Service Science at the University of Geneva in Switzerland. He completed a Master's of Science degree in Computer Science and Engineering in 2020 and a Bachelor of Science degree in the same field in 2018 from the University of Beira Interior, which is in Portugal. His thesis focused on the research and implementation of deep learning techniques for predicting atrial fibrillation, applying innovative approaches based on sound and image processing methods. Currently, he's a corresponding member of the Professional and Educational Activities Subcommittee at IEEE Region 8. He's a promoter and volunteer teacher, and he started that with a focus on humanitarian aid in several areas where health and education are a priority in countries based in the African continent. He's also held several positions in many organizations, such as of the Student Union. Was that a question? Oh, Student Union Chief Technology Officer of the Star Junior Enterprise, and his research interests include predictive algorithms, quality of life, health technology, artificial intelligence, bioinformatics, wearable technologies, and human-computer interaction. Now, his current dissertation focuses on developing and testing an innovative approach to pre-diagnosis of Alzheimer's disease, the main cause of dementia worldwide, by the analysis of daily life routines, health signals, as well as health signals, and other methods towards a smartphone and wearable solution that can predict the condition years before the clinical diagnosis started. Now, for his talk, he has it divided into several components, which he would go through. But really, the focus is to look at, how we are utilizing big data in answering some health solutions. And we know the expanse of wearables, smartphones, smart devices, smart bottles. But how are we using this to even guide, even use them in an emerging way? This is what his presentation is going to be covering. So 3 things is going to really focus on: the benefits and challenges of big data problems in our current days. Then he's going to present and compare the state of art computational approaches against, the traditional statistical techniques that we use when analyzing big data in health sector. Then finally, he'll walk us through application of mobile technologies in pharmaceutical projects with an example of a study aimed at the early screening of Alzheimer's disease using connected devices such as a smartwatch. I'm sure you're tired of me talking, so I'm going to just turn the mic over to our guest. Please join me in giving a welcome to Igor Matias. Over to you, Igor.
Thanks a lot, Mo. And thank you very much for your invitation. It's a pleasure to be here with you today. I will just start sharing the screen. And at the same time, I want to welcome every attendee in the room. I can see you still here. Yep. Okay. So can you see my screen correctly? Yeah. Nice. Okay. And Mo, sorry for the big bio that you lost some time there. Just hiding this floating meeting controls. Yeah. Okay, so as Mo said very accurately, I'm Igor Matias, and I am a PhD student at the Quality of Life Technologies Lab, and also member of the Cognitive Aging Lab from my co-supervisor. And today we are going to talk about data overdose, specifically about the side effects and metabolism of big data in the 21st century. That is, besides this funny title, we are going to talk about the benefits, the cons, and also how to deal with this enormous volume of data that we have nowadays in our daily life. So, before that, my disclaimer: I have no financial or non-financial relationship to the products that I will present. And let's start with
your screen is still loading. I don't know if you meant that intentionally. We're just seeing
sorry?
loading. Yeah. Are you trying to present a slide?
Oh, okay.
Okay. Yeah.
So I need to share the desktop, and now you see it, right?
It's white. Is that? Oh yes. There you go. Yes.
Yeah.
We're good.
Okay. So that's the first slide. That's the title, data overdose, like I said. And we're going to talk about the pros, the cons, and how to deal with this enormous volume of data that we have nowadays, specifically talking about health and also pharma settings. And I am Igor. My disclaimer: I have no financial or non-financial relationships with the products that I'll present. And let's start. But before I start, even knowing that you already know a little bit about me from the biography, let's talk about where is home for me as of today. So I am from Portugal originally, so I am Portuguese, and I was born in a little city in a, let's say, 40,000 inhabitant city on a mountain hill in the countryside of Portugal, with beautiful castles and an amazing landscape and a very good connection to the nature every single day. And this is my country. So my country is known for the good sand, good water, good people, good houses, also for good cities and very ancient buildings in those cities. And also with good bridges. That is a thing that we learn to build since the first day that we start our school in Portugal. And that's one of the things I learned from very young age, including that the fact that the sky is the limit when we go for our ambitions and we try to go as far as possible. But currently, I live in Switzerland. That's my current home. And I live specifically in Geneva, this beautiful city, this beautiful international city with very good culture, very good people, and very good food. Also home to multiple international organizations, including the United Nations that you see in this picture. Also very good lakes, of course. And lastly, very good mountains. But I think that you already know that. You already know that Switzerland is known for the snow, for the mountain, for the ski, and also for the lakes. So resuming, I'm Portuguese. I graduated from Universidade do Interior in Portugal in computer science and engineering, like Mo said, and now I'm at the Université de Genève and the University of Geneva in Switzerland. But now let's move to a more scientific version of this map. And let's talk about the first topic of this talk, about health expenditure, specifically the percentage of the GDP from Europe countries. This is the latest result we got from the World Health Organization, WHO, and refers to 2019. And here you can see that Switzerland is on the top of the expenditure with health, and this covers not just the direct money spent by the government, but also the direct the indirect expenditure with health from private people. And just for you to compare, USA is out of this scale, so it's a little bit higher. But for design-wise, I could not include the entire planet in this slide. And now, if I contrast this first map with another one, refers to the death by non-communicable diseases, so percentage of the total deaths per year in 2019. you can also see that the entire continent is above 80% of this percentage of total deaths, and Switzerland is at the third level between 88 and 90, which is the same for the USA. So with this, we can see that these non-communicable diseases are a big part of the healthcare system, and also of the deaths that we have every single day in this continent, and it's the same around the world a little bit. So now you might be thinking, what is this non-communicable diseases? You might know it as chronic diseases. That's the most common name for this. And according to the WHO, they tend to be, and I quote, of long duration and are the result of a combination of genetic, psychological, environmental, and behavioral factors. And also, according to WHO, these non-communicable diseases account for more than 40% of the annual deaths worldwide. And according to WHO, still, these non-communicable diseases have a lot of causes, a lot of reasons for them to appear. But we can refer to these modifiable behavior risk factors, so something that we can change in our daily life, and this will have a direct impact in this type of diseases, including tobacco, excessive salt in our diet, alcohol consumption, and also insufficient physical activity levels. So the key response from the WHO, the recommendations for fighting this or just lowering these risk factors that we can change in our daily life are to detect them, to screen for this type of diseases quite early, to treat them, and finally to do the palliative care and other aspects. And for you to have a better idea of what's the impact of these behavioral aspects of our health in the research nowadays, there is this very recent study from 2023 which screened all the articles between 2018 and 2022 and found out that more than 5.5K papers per year are published between those 5 years were published just focusing on intervention studies involving behavioral aspects. So these behavioral aspects, you might be wondering what they are. They are exactly the same as I said before, that they were referred by WHO. They refer to tobacco, alcohol consumption, and physical activity. So no surprise there, right? They also include others, but the main ones are tobacco, alcohol, and physical activity. So remember that we have 5.5K papers per year over that from these 5 years, just 5 years with this following this approach from WHO. And now you might be thinking, okay, but Igor, we thought that you were talking about big data. So where is the big data here? I will tell you in two ways where the big data is. The first one is in medical records. So I have this also very recent study from 2023 that in which the researchers thought, okay, what if there was a link between virus exposure throughout our life and our neurodegenerate, sorry, that's complicated. So the brain diseases up to 15 years after our viral exposure. So they found, they found that this virus exposure was indeed significantly associated with this type of diseases. And for example, they found that a viral exposure to encephalitis was directly associated and significantly associated to Alzheimer's disease up to 15 years after this viral exposure. And also our common influenza that was so popular before COVID, and now it's kind of in the background. This influenza was significantly associated with also Alzheimer's disease, amyotrophic lateral sclerosis, generalized dementia, Parkinson's disease, and vascular dementia, which is a very specific type of dementia. So as you can see, the big data was kind of useful in this case because they basically went to pick some big databases in virus exposure and brain diseases over a long period of time, and they just tried to correlate these two factors, and they actually found something meaningful. And this is one example of big data that you have currently in the health sector, but this is kind of a painful one because most likely they were analyzing very different data from records to records, and that's not a very practical way to do big data research nowadays. And the second way to get this big data is, of course, the big data that we have everywhere. So, for example, your smartwatch or your smartphone. According to a study in 2011 from this same lab, the lab I am, a smartphone is more than 80% of the day around you. It's not directly connected to you. It's not in your pocket. It's not something like that, but it's at least around you. So it can actually perceive something in your environment, and it can detect something that can happen in your daily life. And this was from 2011. We are now 12 years after this research was published. And now you might be thinking, okay, smartphone is probably even more time around us every single day. And what about the wearables? We have wearables that they didn't have in 2011. Maybe we should have a look at that. And surprise, surprise, the power of wearables was already investigated as well from our lab and was published in a chapter of the book Digital Health, Scaling Healthcare to the World. And the theme of this study screened the literature and the web for all the devices, all the wearable devices produced or under the way to be released between 2001 and 2018, and they found 438 devices. The figure on the left shows you a little bit about the ways to place those wearables. And mostly they are spread around your head and your chest, and that's basically it. But from this same research, they found that this 438 devices, 55% of them were dedicated to just track physical activity, or at least physical activity. They could track two or more aspects at the same time. And the second behavior tracked of interest for this talk was sleep, accounting for 12.5% of those 438 devices from those 17 years. So remember physical activity and sleep, because that's important for the rest of this talk. And remember that was from 2018, but recently in 2022, so just a few months ago, there was an article also talking about the growing popularity of these wearable devices being used in the research worldwide. So they screened 179 articles from 179 studies happening between 2013 and 2020. And as you can see in orange, you can see that the rate of growing of this number of studies involving wearable devices is actually quite rapid after 2016. And for the number of participants, you can see that it's quite stable until 2018, or a little bit slow, let's say. And then in 2019, we have a huge spike. 2020, we have a little bit less spike, which is probably due to COVID-19, but that's not the focus of this talk. So you can see that 179 studies between 2013 and 2020, and also more than 10 million participants. Just for you to have a better notion of what's this number about, Portugal has around 10 million inhabitants, and Switzerland has less than that, less than 9 million inhabitants. So this is the same as getting the entire Portugal population, and during these 7 years, just doing studies with that same population. And these authors, these researchers, they also went deep in each one of those 179 studies, and they looked for the reason of this use of wearable technology. So they found out that 39%, the majority of the papers, were trying to find correlation or influence, estimate some influence or get some correlation level between one metric and another one that they could track with a wearable device. And the second reason was to characterize population, so just to cluster or understand better a certain population with these devices, because they are connected every single day, and they hear us every single day, let's say. So still in this article, they also examined the medical fields, exploring this wearable technology, this, let's say, accessible big data from 2013. And as you can see, in 2013 and 2015, only cardiology, fitness, and sports medicine were using these kind of devices for research. But then after 2016, this cardiology, fitness, and sports medicine kept using it, let's say the same amount until 2019, but then multidisciplinary and internal medicine and other fields of medicine started exploding with this kind of research. So there was something happening back then, and maybe we have a big data explosion since 2016. And then they also went into detail and analyze the type of the studies this research was talking about. So this could be observational studies, this could be randomized trials, this could be something else. So they found out that according to the number of studies, 71% of these 179 studies were performing an observational study, and then RCT followed for 6%, and then other type of studies, or the very, very specific types of studies. But when they went for the participant level, they found out that 96% of these 179 devices, they were actually doing observational studies, and only 0.02, yeah, you heard that right, 0.02% of the studies of the 179 were using RCT, randomized controlled trial approach, with these kind of devices. So maybe we should have a better look into this observational data, right? We will have in the following parts of this presentation. Just to conclude this slide, I want to tell you that the most investigated parts of data with these wearables devices was physical activity, heart rate, and sleep. So you remember physical activity and sleep from last, right? You remember that from the WHO and all the other studies. So here they are. The heart rate was included, but the physical activity and sleep were already quite in a spotlight since the start of this presentation, and now you see why. So now you already have this, let's say, big or small picture of what can we use the wearable devices for, and you might be wondering, but what's the advantage for that? And I will exemplify. The first example for that is zero questions, 99% or so sure. Why? Because these devices can actually they can actually collect so many data from your daily life that they can actually perceive something that you don't know they are able to perceive, because they are so deeply connected to us every single second of our life. So one first example, it was a study from 2020 trying to also from this lab trying to compare or correlate how the participants of the study were filling out some kind of emotion self-report, and how their passive data from wearables devices was responding to this, or at least how they were behaving at the same time without having any direct impact from the questionnaire on their wearables data. So they found a very high correlation, according to Spearman rank, between physical activity and social support, and sleep duration and anxiety or stress. This means that just by looking at the physical activity and the sleep duration, there was a high confidence to deduct or to calculate or infer the social support and the anxiety or stress levels of that same participant during that same moment. So they, according to the results of this paper, you don't actually need to tell someone how is your social support or your anxiety or stress levels at that specific moment, but we can actually deduct it with a certain error, of course, but we can actually deduct it from your passive data that you collect every single second or every minute with your wearable device. But don't be afraid. That's good for your health. So a second study from 2023, also very recent, still a preprint, was following the same approach from the questionnaire side. So was asking let's say the more or less the same questions to the participants over time, and at the same time was tracking their sleep. So specifically the sleep, just the sleep, and they were using this following an approach with the participants with type 1 diabetes, and they were using actigraphy. So instead of wearable, they were using actigraphy, but the results are still relevant for this talk. So they found out that an increasing sleep duration. So when the sleep duration was going higher, the stress levels were going down for these participants, and when the sleep duration was also going up, the negative effect was also going down. This including disappointment, sad, tense, upset, and anxious feelings. And that was the first example of how can you what are these wearable devices good for. But the second one is to actually anticipate your future. So another study from 2018 was trying to correlate the cognitive function to the passive data that you collect with your smartphone, just your smartphone. So we don't need your wearable right now, at least. And they were trying to develop a thing called digital biomarkers of cognitive function. So they were trying to, let's say, infer your cognitive function just by looking at the digital biomarkers, which were just provided by the phone passively. And they were just looking at the way people were using the phone, how they tap the phone, how they move from app to app, and other things that you do, like not on purpose when you use your phone, but this can actually reflect something. And what did they found? This was correlated with your memory levels, not the participants. Also the language ability of that participant, the intelligence, the executive function, and finally the working memory. So the instant memory, the memory you use every single moment of the day. And another example of why they are important and how should you consider them is because these wearable devices, specifically a smartwatch this time, is able to force you to be a better you in your daily life. So this study from 2023 combined physical activity data with some intervention, some motivation intervention to the participants, and they did this with a randomized control trial. This case, it's one rare case with wearables because they use a randomized control trial. So they followed 162 adults for 5 weeks, and they divided these adults with 4 groups. The first group was actually getting an accurate display of the step count on their smartwatch. So whenever they were looking at the smartwatch, they were getting the accurate display of the step count. The second group was getting a 40% deflated. So let's say that participant XYZ was actually with 1,000 steps at noon someday, but when checking the smartwatch, this participant was not seeing 1,000 but 600 steps. So they were getting less reported to their mind than they would think. The third was 40% inflated, so they were increasing the real step count by 40%. And the fourth and last one, they were still also providing the accurate display of this step count, but also doing a web-based intervention. So they were just asking the participant to go to watch some video, some motivation video for them to motivate themselves to just do some more steps during that day. And they found the following. The first group, seeing the accurate value of the step counts, was found at the end of the 5 weeks without any force from from the researchers team, so voluntarily following an healthier diet. And also, these participants from the first group, they were found to be of better health at the end of the 5 weeks. So they improved the health, and they improved the diet. The second group, getting 40% less than the real step counts, they were actually getting following an unhealthier diet than since the start, and also getting more negative effect than at the start of the 5 weeks. For the third group, there were no conclusion, and for the last one, seeing the accurate number of steps and also following the intervention, they were found to have more positive effect at the end of the 5 weeks, and also having a better functional health. And okay, so this might be okay for you to understand. This might be quite logical, because it's okay, it's your self-motivation, you are just playing with self-esteem and all that. But what if I tell you this last thing of this slide? The step count did not change at all. So the participants, or majority of the participants, at the end of the 5 weeks, they were actually having roughly the same number of steps that they were having at the start. So that's the first group didn't improve the step counts. They were doing the same step counts roughly, but they improved the diet and the mental health. The second one was actually getting the same step counts, but they thought they were not. So they moved to an unhealthier diet, and they had more negative effect. And the last one, accurate and intervention, they also didn't find any difference in the step counts at all. So they just ended up thinking they were better, they were doing better, they were having more physical exercise, and they were just motivated, self-motivated to change something in their diet and in their lives, and they ended up doing some good to them. So this is a way for you to see that just a simple smartwatch that is attached to you every single day can actually motivate you to change something in your brain, not in your physiology. You just need to believe you are performing better, and you will eventually do. So so far we can answer this question already. Are the wearable devices good? Well, I think they are, right? But the other side of this coin about wearables is, what about its data? Because we get data like every single second, or every 10 seconds, or every hour. You choose the device and you name this frequency. But what about the data? The data is collected with a lot of noise and with a lot of things that we don't want to measure, and they still get in interference with our wearables data. And about this question, well, it's complicated. So let's discuss that a little bit. So let's say that you are trying to check if sleeping better, so let's say sleeping more hours every single night, will actually have an effect on your physical activity levels the day after. So let's say you believe that when you sleep better, you can actually do more steps, or you will involuntarily just follow this and you just do more steps, and you want to see if it's true or not. So you can just track your sleep with your wearable, and you can track your step count and your physical activity exercises with your wearable. That's quite practical, right? However, there's something missing in this picture, because if you do this just following the normal procedure, just using the device, there's something in between the conclusions that you get and the good conclusions you should get from this type of data. For example, the weather can interfere both the sleep and the physical activity. The seasons can also interfere that. You can be more willing to go for a run, or go for a walk, or go for ski, depending if it's winter, if it's fall, if it's raining, if it's snowing, you name it, right? You can just imagine all the things that can interfere in that. And also even jet lag, for example. If you have jet lag, you will perform worse on sleeping, and you can actually decrease your sleep time the days after. And this will actually impact the time you are awake, and also your mood, and this mood will interfere with all your physical activity, motivation, and all that. So these are just 4 simple examples of what we call confounders. So all these 4 examples are not just 4, are plenty of them, and we call them confounders. And that's the reason why we run randomized controlled trials, because by doing so, we can actually deviate a little bit from these confounders and estimate the real effect of, for example, the sleep on your physical activity levels the day after. And this means that, okay, now you have a smartphone, now you have a smartwatch, and now you have a huge river full of data just flowing to your computer, to your iCloud account, to everything. But what's the real meaning of that? Because in the end, you are not facing real data. You are really facing hieroglyphs. Why? Because you are looking at them, you can read them, you can see what they are from the exterior, but for you to get the full meaning of the hieroglyph, the full meaning of your sleep data, the full meaning of your heart rate data, etc., you actually need to go deep in the data, and you actually need to investigate a little bit more this type of data and combine them and have some clever way to decode the real code behind it, because they are continuously monitored and not following a randomized control trial. So of course, now you are thinking, okay, so Igor just led me to a dead end. I mean, if the data is not good, why should I use the data? Why should I use a device that will collect this data? Because, I mean, in the end, I cannot use it. Well, you can use it for with two different ways. The first one is, of course, if you follow a randomized control trial with wearables. And we did so in 2019 in this lab. So we did a study with one participant only for 24 days, and we followed an intervention plan. And we were also measuring the outcomes, of course, to check the effect of this intervention on in the outcomes. So for intervention, we used the sleep deprivation. So this participant was actually depriving the sleep or not depriving the sleep for certain amounts of time during those 24 days. And they were checking the outcomes being the blood glucose, craving, and negative effect. And this was a non-diabetic participant. So we were just they were just measuring the blood glucose just to see the changes after the sleep deprivation. And they found out that when the sleep deprivation was present, so when the participant was not getting enough sleep, the blood glucose was going higher, the craving was going higher the day after, and the negative effect was going higher the next day. And okay, so this is a way for you to do it, but this is a, let's say, silly example, you might be thinking, because this is one participant, but only for 24 days. So even if you just want to see something about yourself, you are one participant, okay, that's good. But what about 24 days? I mean, you cannot just, if you want to see the long-term effect of, for example, your sleep in your physical activity levels, or even your blood glucose or craving, you cannot just deprive your sleep for 6 months or 1 year in a row. No, you should not, right? Because if you do, well, that's a nightmare, and I don't advise you to do that. So that's why we have a second option. And the second option is for you to get as many data from this daily living environment that you are in, so with your wearable and your smartphone and all the other connected devices you can get and you can wear during your daily life, and just get it down to a simulation. So let's say we gather all the data, as many data as you can get, and then we use computational models to recreate these scenarios and actually do something, let's say, magical. Let's see if it's magical or not. So this is a method intended to help you decode your hieroglyphs, so your daily life data, observational longitudinal data, without any randomized control trial happening. And this can be for 1 week, can be for 6 months, can be for 3 years, 10 years, 15 years. It's up to you. And the idea is to use artificial intelligence and get you some conclusions on the person, on the participant level. Even though you can also do it for the population, right now the first version is intended to help you getting some conclusions about the one participant at a time. So even if you do a study with 20 participants, you will need to do the conclusions for each one of them, because each one of us is different. So this method is called model-twin randomization, and we call it MOTOR for short. And it serves to estimate causal effect from the data you collect, so from your hieroglyphs, from the data you collect longitudinally and observationally. And what it does, in a simple way to explain, is it gets your observational data. It can be n of one or can be n of many, but then you need to do the approach one by one, recommend. And it will just simulate an n of one randomized control trial. So by scaling down your real life reality into a computational model, then it will, let's say, simulate every single factor in that daily life that it collected, and then it will try to infer the real, or at least suggested, let's say, closest to the truth effect of one variable on another. So some examples of application for this motor. We already did it in the last year in 2022. And we followed an approach with n equals 3, so 3 participants, but then we got conclusions for each one of them, don't worry. And we gathered observational data. And we did this observational data collection for 1,426 days for one of the 3 users, and then 148 for the other 2. So as you can see, you can use a lot of data, or you can use just a little bit of your ear, and that's it. It will be some kind of limitations on your power of conclusions, but it's up to you. It's up to the availability of data that you have. So we had the following exposures and the following outcomes. The exposures were physical activity levels, so step count, and yoga. So this was binary, either we were doing yoga or not. And the third one was stress levels, either we were stressed or not during the day. And the outcomes, so we were trying to check the possible or suggested effect of each one of these exposures in two outcomes. The first was the amplitude of the sleep heart rate. So the heart rate during your sleep phase, only during your sleep phase, not during the day. And the amplitude was getting the maximum minus the minimum for us to see if the variation of your heart rate was too high or too low during that sleep period. And the second outcome for the 1,000 days of data was the average only. So for one of the participants with 148 days, we got a conclusion telling us that when this participant was getting more active than the mean number of steps per day, the suggested effect was getting an increase on the amplitude of nighttime heart rate for this specific participant, which was kind of weird for us to find, but it's possible. Each one of us is different, so that's why we have these methods for us to do this kind of self-awareness of our health and our body. And for the other participant, for one of the other participants, the participant with 1,426 days, we checked for the suggested effect between yoga, stress levels, and physical activity on the average instead of the amplitude. So we were looking for a change in the average nighttime heart rate whenever there was yoga, stress levels, or physical activity during the day. And we found out that the yoga was actually increasing it, the stress was increasing it. That was okay, we were expecting it. And physical activity was lowering down this nighttime heart rate, which was good. We were also expecting that. But okay, now you probably are thinking, yeah, now we know why do we need big data? Why do we need wearables? Why do we need connected devices? How can we get good conclusions for that? And yeah, it's better now, but what about applicability? Is this applicable during our daily lives? Let's talk about it. So the motor is, let's say, planned to be applicable in multiple scenarios, and some of them are this. You can test your self-beliefs without doing an RCT. So if you just believe, for example, that your sleep is actually influencing or taking a big effect in your physical activity levels or on your mood the day after, something like that, you just need to collect the data, you just need to run the motor, and this motor will tell you some, let's say, limited conclusions about this possible effect that then you can decide, okay, so maybe there's something here, maybe I should run some kind of N of 1 randomized control trial, just to be sure that this is the real effect or not. So the motor is just putting it closer than just getting a correlation between one of them. We are actually giving you a way to say, okay, this is the cause of that. We do that, and the cause is doing that. That's it. The second applicability is for you to study some hypotheses that are not feasible for an RCT. For example, the RCT that I gave the example with wearables, depriving your sleep for 1 year. No, it's not an option, right? Unless you want to do that, but I wouldn't advise for you to force your sleep to be deprived for several days during 6 months. That's not good. So you can just collect the data observationally, and then you run this method or similar methods to do this simulation. It can also help you on deciding treatments before an RCT. So specifically for pharma sector, this means that you can actually collect data from daily life with several medications, several other aspects of your life. And before you do an RCT, you actually need to decide the threshold, right? You need to decide how many milligrams you take from this, how many X you get from that, and all that. In this case, you don't, because you just collect the data. You just vary the data every single day, just normally, just like you do every single day. And then when you do the method, you can actually simulate, okay, so what about this threshold a little bit higher? Is the difference, is the suggested effect higher or lower? Is the result better or worse than having this low threshold or high threshold? So that's how you can help you deciding these treatments. And ultimately, you can also, for example, this is just 4 examples of applicability. It can also help you reflect on confounders before an RCT is made. So you can just think, okay, I want to do an RCT with this, and then, am I missing something? Let's just get some data from the daily life, and let's see if the results are good enough, or if there's something still missing, and we should actually think about it before running the RCT, because maybe it would be good for us to not to control because it's an RCT, but maybe it's better for you to collect this data so that you can just discuss better the results of the RCT at the end. And before I move to the final part of this presentation, I just want to share with you this QR code and also the link below it. So if you are familiar with Python, just basic knowledge of Python is required. You can actually run this first version of the motor method with your own data, or with any data that you can find. You can just freely use the code. And now moving to the final part, just to give you a little introduction to my PhD research and my current state. So my PhD research started in 2021, and the initial plan was to provide a computational tool, so digital biomarkers, to detect the change from healthy brain, so healthy cognition, until the dementia phase of Alzheimer's disease, including the preclinical and MCI phase in between, just by using passive data from your smartphone and your smartwatch. So following the same approach as some studies that I referred, doing some validated measurements such as questionnaires or cognitive games, and at the same time doing the passive measurement, and then trying to find some matches with patterns of data and some other technicalities of the project. However, this was in 2021. We are now in 2023, and a PhD is made of this. Changes occur, time limitation appears, and some ethical changes and funding limitations made me change my topic, or at least just adapt it, not change it. It's going instead of the big project, because it would not be possible to do this within a PhD research time. I am now planning to go for a feasibility study of that. And instead of moving directly to the Alzheimer's disease, I am going to develop a tool to assess cognitive performance fluctuations, which are normal and occur every single day of our lives, So sometimes you wake up and you are very good focusing. Sometimes you are not. Sometimes you wake up and you can easily change topics from one another, and sometimes you are not. This is quite normal. There are a lot of factors influencing this, and you are not sick if you have this. But the idea is to do the feasibility study and develop a way to do this passively with the same data from the smartphone and the smartwatch, which will be the first stone in this let's say higher building that will be after the PhD, hopefully. So the idea is to do this on a two level, inter-individual and intra-individual. So the first one is to check for changes and account for the entire population of the study. And the second one is for intra-individual. So I will be looking at the individual level and see the changes over time of that specific person, and not just comparing to the rest of the population, because sometimes we are outliers and sometimes a medication is not good for us because we are not exactly in the same center of the population used for that same development of medicine. And of course, you might be wondering, the inter-individual variation is a very good approach, is a very good case scenario for motor to be applied, and that's going to be one major part of this analysis of data. And before I finish, just giving you this derived version of an original quote from Lord Kelvin, the creator of the Kelvin temperature scale, which says that if you cannot measure it, you cannot improve it. So by this, I mean that if you don't track your health continuously, if you don't measure every single thing that it's so easy right now to measure, and it's so, let's say, not cheap because it depends on the device, but so accessible to the current world population to just buy a smartwatch, even if it's very expensive, very cheap, the error of the measurement will be different, but still it is a measurement, and you still can have a very not very detailed, but at least close enough view of your health. You won't be able to improve it if you don't do so. So why not? Let's just start measuring our daily life, start measuring our daily health, and try to better understand yourself, and just try to improve it. And yeah, before I finish, just don't forget that any sufficiently advanced technology is indistinguishable from magic. So remember the magic that I referred before. I was not saying that I'm doing magic, but at least my focus is to do technology as good as possible, so it is undistinguishable from magic.